I am Dr. Malik, intensive care specialist. Yesterday evening, we got a 35-year-old gentleman who is married and who has got a 4-year-old son who was brought to us. There was no BP, there was no pulse, there is nothing. So when we did CPR, everything for him, whatever we have to do, but we know that there is nothing. He was brought dead. But still we did CPR because we have to do something for the patient. We did. So when we asked his wife, she said that 15 minutes back, she complained of chest uneasiness, some uneasiness behind the chest, some burning or uneasiness, and I gave him buttermilk, and within 15 minutes he collapsed. That is what the history said. History was told by wife. So this, I wanted to do one topic on this called sudden death. Sudden death, you can call it sudden cardiac arrest or sudden death. It is mainly because of about 3 or 4 conditions. Number one, pulmonary embolism. What is this pulmonary embolism? Pulmonary embolism is a condition where a small blood clot, usually from the cough, usually from the lower limbs, cough area, it travels throughout the body in the blood vessels, enters the right side of the heart inside and goes into the pulmonary blood vessels. And blocks the pulmonary blood vessel, blocks the blood flow in the pulmonary blood vessel. This is very dangerous. The patient without any symptom or any sign suddenly collapses. We have seen there is a big difference, gap between cup and lip, they say. This is the condition where there won't be any pain, any symptom, suddenly the patient collapses. This is called pulmonary embolism. So very, very dangerous. A small blood, a reasonably sized blood clot. Small blood clots, they don't cause that much. A reasonable size of blood clot which can obstruct the pulmonary blood flow. They get this stuck up in the pulmonary blood circulation, and the patient may breathe like this for once or twice and gets arrested, immediately collapses. That is one condition. Number 2 is massive heart attack. That is what yesterday evening I encountered in the young gentleman. Massive heart attack. Probably he must have had some blocks. He didn't know that. There was no pain, there is nothing. He's a perfect gentleman. He plays tennis also. But suddenly a blood clot sits in the area where he is getting blood flow. The rest of the blood vessels may be already narrow or already clotted. Maybe the important place where he is getting blood supply is also clotted, is also clogged with that blood clot, and suddenly there is no blood supply to the heart. He collapsed. So this is another condition called massive heart attack. Number 3 is aortic rupture. Aorta is one big pipe which comes from the heart. There is a big pipe which supplies blood to the whole body, upper body, lower body. It comes out of the heart. Heart pumps blood into the aorta. So aorta supplies blood to all the parts of the body, upper body, lower body. What happens if there is high blood pressure, 250, 260 like that, very high blood pressure? Once the blood is flowing through the aorta has got a very thick wall. It is having a thick wall. It's a big one. It is having a thick wall like this. So once there is a high blood pressure in the aorta, once the blood is flowing through this, there is a chance that the blood has to flow inside the aorta, but sometimes it tears the aorta and flows in the wall. The wall is torn and blood flows in the wall, actually inside and into the wall by tearing the wall. This is very dangerous. And one thing is, the patient complains of immense pain coming from front to the back, immense pain, and collapses within no time. So very difficult to resuscitate this pain. The patient, once or twice I have encountered this case, but we could not save the patient. It doesn't give you time. And another one is severe arrhythmias. What is arrhythmia? Arrhythmia means the heart beats according to its own style. It doesn't follow the norms. Very fast heartbeat, irregular heartbeat. Normally the heartbeat, we all know, it is per minute. It's 70 to 80 is the heartbeat, and it is regular like this. This is the normal ECG. See, P wave, Q wave, R wave, S wave and T wave. This is the normal ECG. And again here P wave, Q wave, R wave, S wave, T wave. This is the normal ECG. But in arrhythmia, this doesn't occur at all. It goes according in its own style, that is ventricular fibrillation, ventricular tachycardia. See, this is like a saw movement. You can see the heart beats like and it is about to stop. The heart stops at any time. The heart can stop at any time by beating irregularly. Usually happens in electrical shocks. When you receive a massive electrical shock also this can happen. So the thing is, not only electrical shock, there are other conditions also which can cause it, and without any outside stimulus also it can happen in a little diseased heart, or we don't know, patient may be all right apparently, maybe he is having some cardiomyopathy inside. We cannot check every patient, and suddenly the patient collapses. So in this case also, first we do CPR. We all know about CPR. First we do cardiopulmonary resuscitation. Next is we apply defibrillator. You all know about defibrillator. We apply on the chest, give electrical shock about 200 joules 2 times daily. And there is another device nowadays called AED, Auto External Defibrillator. This is now, it is a very important device which is available in shopping malls, cinema theaters, etc., etc., and public places, where you just put it on the chest and switch on. It gives automatically defibrillation. That means it tries to bring back the heart to normal shape. But these are all not easy. It requires little trained individual. Not everybody can do it. But see, these are the things to be learned in future also. This is to summarize how sudden